Tēnā koutou katoa. Welcome to eHealthTALK NZ. I'm Rebecca Macbeth. I'm the media editor at HINZ, and today I'm joined by Cushla Smyth, Chief Executive of the Medical Technology Association of New Zealand, and it's part of a collaborative series we're doing exploring issues and themes relevant to the medtech sector, manufacturers, importers, and distributors of medical devices in New Zealand. So welcome on the show, Cushla. It's great to have you here. And we're going to talk about the upcoming MTANZ Conference. It's part of HealthTech Week on June 29th to 30th at the Hilton in Auckland. The conference program this year, it's bringing together everyone from ministers and regulators through to clinicians, suppliers, and patient advocates. So I was wondering first, what was the vision behind curating this broad mix of voices?
As you know, because you've attended a number of times, it's a great opportunity to hear directly from stakeholders that influence the direction of health. And because nothing happens in isolation in health, it's really important that you get that broad and diverse range of stakeholders all in one room.
Their opening day features updates from the Minister of Health, Health New Zealand and Pharmac leadership. Can you just tell us about those speakers and why it's important for industry to hear directly from those decision makers at this point in time for the health tech sector?
Yeah, it's a very interesting time at the moment, and we'll go into that a little bit more. But we're really excited to have the Minister of Health open the MTANZ Conference. We formed a relationship with him over the last 12 months with the advocacy work that we have been doing. So he's really familiar with the issues in the sector, which is helpful, and he was happy to attend, so we were very happy. In terms of what he will talk about, we've specifically asked him to give us an overview of the National Party's policies in health. And although that he was involved with Minister Seymour on the medical device management decision, we're going to leave those progress reports and stuff to more of the operational staff for Pharmac and Health NZ in day 2. So he will just specifically go over health policies that they'll be campaigning on. And because there'll be a general election this year, we've also asked some of the other parties to sit on a panel and talk about their health policies as well. So we will have representatives from the ACT Party, from NZ First and the Labour Party as well. So it's a great opportunity to hear about the health policies for most of the major political parties. On the first day, we will also hear from Jason Power, one of the executives from Health NZ, as well as the new CEO of Pharmac, Natalie McMurtry. And we've asked them specifically to speak in their capacity as sponsors of the letter of expectations that was issued jointly by Minister Seymour and Minister Brown at the end of last year. So with the decision that was made about medical device management and that there would be a joint model between Health NZ and Pharmac. At that time, our advocacy work had very much been to the chairs of the board and the ministers. Now that that decision has been made and operationalised, the responsibility will now fall back to the executives of those entities, hence Jason and Natalie being the sponsors. And so we'll hear from that on that and how that is progressing. We'll also be doing a fireside chat with Natalie McMurtry, which is slightly more personal because she'll be there in person. Jason will be online. And this will likely be one of the first opportunities for attendees to meet Natalie McMurtry, the new CEO of Pharmac. So we thought it would be great just to hear a bit more about her, what her drivers are, her background, what she thinks that the opportunities are in Pharmac, and really her vision for Pharmac. And she only moved from Canada in September last year, so she's still relatively new, and we really wanted to ease her into it.
Excellent. So I noticed from the program that sort of standout themes are around regulation and reform. There's obviously a lot yet to become clear in each of those areas. So how significant are the next 12 to 24 months going to be for New Zealand's medtech sector?
Yeah, there's a lot to consider here. We've talked about one of the major initiatives is the medical device management transition. Then also there will be the introduction of the new medical products bill, which is now being pushed to the beginning of 2027 to put that through into Parliament. And if you think about the preparation that's required for a new regulatory regime, all the operational work that is required to embed this new procurement and health technology assessment model, we've got an election at the end of this year. And if we get a new government, what will that look like? I mean, conceivably, they can go in a completely different direction on both of those things, both on the market access structures and policies as well as the regulatory policies. So I guess there is quite a lot at stake around the election. We've been waiting on those decisions around medical device management for a very long time, sort of up to 10 years. There is really needed some clarity in that area. In terms of a regulatory regime, we've been waiting 20 years. So it would be incredibly disruptive if those decisions were overturned. So that's part of the work that MTANZ is doing outside of the conference, is ensuring that the opposition parties are aware of the level of disruption that it would cause if they did come in and overturn those decisions that have already been made.
There might be something that comes up in your panel discussion. Bipartisan support for these sort of long-term plans and regulatory regimes is so important for industry, isn't it, to have that security of knowing what's going to happen. We've also got, talking about the future, AI is appearing throughout the program. It wouldn't be a tech conference if it wasn't. So, from operational efficiencies through to regulation and governance, what are you hoping attendees will take away about the practical role AI can play in healthcare right now?
I had a couple of objectives for this one. One was around how that we apply AI tools in the businesses themselves, and the other one was around developing AI products as medical devices. Both are super interesting areas. So the first one, in terms of gaining efficiencies and implementing AI tools in the business for efficiencies and scale, I was at not the last HINZ event, but the one before, about AI. I saw this incredible presentation from New Zealand Health Group around the suite of tools that they had implemented in their business and how successful that they'd been, what that process was like to them, what were the most important things that they learned. And I thought that would be super helpful for our audience as well. Interestingly, I've just been at a conference overseas and I attended a lot of the AI sessions. They talked a lot about, we're really now past the stage of early adopters for AI tools in businesses. And so, there's probably a better return on investment now than it was, and it will be easier for the fast followers. But they really made the point a lot of times that if you are not in the fast follower group and say you're in the third wave, with how quickly these technologies move and the ability to scale and the efficiencies that you can gain, if you are in that third group, it's actually going to be very hard to compete. And that really got me thinking about New Zealand businesses, and I think this is probably an area for collaboration with HINZ and DHA as well, around are New Zealand SMEs actually ready for this? Do we have the capability and resources in New Zealand to implement AI into our businesses? And I'm not really sure of the answer, but I think that's probably a future workshop. And then the second session that we have is around regulation of AI. I see a lot of stuff online around, wanting New Zealand to be a real leader in this area of implementing AI tools into the healthcare system, but also developing AI products that would be classified as medical devices. I think it's really worth thinking about that we don't actually have a regulation system for AI products or software as a medical device right at the moment, but we do have a really good opportunity to get that system and settings right. So we have two experts in this field that are presenting about what everyone needs to think about in terms of AI regulation. We have been working with the Digital Health Association to put together some recommendations to the policy team in the government for the medical products bill around what those settings should look like and getting wider engagement on that, because although at a high level it all seems quite logical what would be included as a medical device and what would be excluded, as soon as you scratch the surface on that process it becomes much more grey. This is an important area for our attendees to hear about at the conference, but also we need to do some further work in this area and include many more stakeholders, including MedTech IQ with the early startups and with HINS as well.
Yeah, it's certainly a hot topic. And yeah, I can see lots of examples where something might start outside the regulation because it's not making decisions and things, but then as it develops, it starts aiding with clinical decision making or making suggestions, which would then push it into the new category. So, yeah,
That's
not
exactly
an easy
right.
journey to navigate.
And I think, the AI scribes is a really good example of that. In that at the moment they're really collecting information and not doing anything with it. As soon as that product evolves into using that data to provide any sort of clinical support, then it does become a medical device. So it's important around what is included now, but also to consider the evolution of that product and what it may become, and they often won't be static.
You're also featuring some practical case studies like hospital in the home at Te Toka Tūmai, Auckland, and the patient perspective that we mentioned earlier. So what was your thinking behind those presentations?
In terms of the patient presentation, you'll notice that I did that pretty early on in the program. I think it might be around the third or fourth session. And I like to do this so that it really helps people focus the mind on why we're there. I think within these conversations, talking about regulations, you're talking about market access, you're talking about technology. It's very easy to forget that there's a patient at the end of this journey that we're all talking about. So I think by having that up front, hopefully people hold that perspective throughout the conference and remember what is important. The hospital in the home presentation is a great example of how medtech can be used to address some of the chronic capacity issues that we have in secondary care. Anybody that's been working in health has been hearing various strategies around delivering care closer to home. I think all of us would have heard that for 10 years or more we've been hearing that, but we haven't really seen a lot of good tangible examples of that. Still, that telemedicine outside of video conferencing isn't commonly used, even though that technology has been around for a long time.
But you're also going to be talking about, procurement, market access, navigating the health system. They seem to be ongoing frustrations for medtech suppliers. So what do your members most want to know or want changed about working successfully within New Zealand's health sector? And how does the conference help to address those issues?
Yeah, there was, if you remember at the conference last year and the conference the year before, maybe the year before as well, anybody that opened the conference said that they would make a decision soon about who would manage medical devices in New Zealand. So the great thing is that decision has been made by Minister Seymour and Minister Brown last year. So there is some clarity and certainty. The work now is really around operationalizing that model, and we still don't have a lot of details around the work plans and timelines of when these work streams will start. We've had some initial work around the transfer of contracts, but I know that participants and attendees of this contract will be very keen to hear about the transition plan, the work plans, the work streams, and timelines, because although this decision has been made operationally and not a lot has changed at the moment, so there is still confusion, there's duplication, there are delays that are still being experienced. So getting a bit more information will be top of a lot of people's lists in terms of the transition itself.
And the HealthTech Week combines the MTANZ Conference with their Te Toki Mata Ora Forum. So that's bringing together industry with research and startup communities. Can you just talk about that alignment and how it benefits attendees and the sector as a whole?
Yeah, I think it's incredibly important as both organizations together represent the whole spectrum of the ecosystem for medical technology, right from the end of the spectrum, which is the research, commercialization, early startup companies, everything that's required down that end of the spectrum, all the way through to the MTANZ end of the spectrum, which is, as you were talking about at the beginning, distributors, importers, multinationals. And it is an opportunity for all of those groups to come together in 1 week around the shared interests. Although that the two individual conferences often have different drivers and objectives as separate conferences, there are always crossover areas like regulation, like the advocacy work that we do with the government, and MedTech, IQ and MTANZ work on those programs of work outside of the conference as well. So it's just a great tangible time for everyone actually to come together.
Yeah, certainly looking forward to attending both this year. So just finally, what would you say makes this year's MTANZ conference a must-attend event for anyone involved in health tech, innovation or healthcare delivery in Aotearoa?
Yeah, so this is, often this is the feedback that we get around attending this conference, is that this is where being in the room really matters. Not only do you hear from the stakeholders making the decisions in healthcare that will ultimately flow on to potentially affect your business, you've got an opportunity to ask those burning questions to the people that you would never have access to ordinarily. So it's very much around being in the room, showing a unified voice and actually acting as a collective. And we have so much more power when we act as a collective.
Well, thanks for joining me today, Cushla. It's been really insightful discussion. And to our listeners, you can go to healthtechweek.nz to find out more about the conference and register to attend. And we both hope to see you there. Mā te wā.